Hello and welcome to another episode of the Break It Down podcast. I'm Chibuike and I have here with me my troublesome co-host. Proud of her to introduce herself.
Well, thank you very much, Chibuike. Hi, everyone. My name is Asari, your co-mayor of the Break It Down podcast,
Co-mayor.
brought to you by Nigeria Health Watch. Here we hold very interesting conversations on health and issues shaping our world. Thank you very much for tuning in. Now, it's Women's Month and it's the day before the International Women's Day, so I bet you can already guess what today's episode is about. If you can't, don't worry, we've got you. It's about maternal mortality and the government's most recent response to tackling this through the MaMII project.
Yes, MaMII. It's not MaMII water, but
I'm always so tempted to call it MaMII.
yeah, but the full meaning is the Maternal and Neonatal Mortality Reduction Innovations Initiative. That's a mouthful, yes, but it's an important initiative, trust me. So the Ministry of Health and Social Welfare introduced it as part of their plans to reduce maternal mortality by ramping up interventions in 172 high-burden local government areas across the country.
Yes, and it was officially announced during the Joint Annual Review meeting last November. Now, the Joint Annual Review is a significant event where the government and health partners come together to assess Nigeria's health sector, evaluate what's working, identify challenges, and then set priorities for improvement. Now, during this meeting in November last year, the Maternal Mortality Reduction Initiative Innovation Initiative, MaMII, was launched to address the alarming rates of maternal and neonatal mortality in the country.
Yeah, absolutely, Asari. And to be honest, Nigeria needs this because, yes, there are efforts, being put to address this, but we need to keep innovating, finding new ways to do this. And Nigeria really continues to face a serious maternal mortality crisis. And to show how serious this is, or put it in perspective, imagine when you say a Nigerian woman has 1 in 18 lifetime risk of dying during childbirth or during pregnancy or even after pregnancy, called the postpartum period. And this is according to the this is according to the WHO, the World Health Organization. It's
right. It is absolutely heartbreaking, and it makes you wonder, why are Nigerian women still dying while giving birth?
That's an interesting question, and a question that we need to be asking ourselves every day, right? And Nigeria Watch actually did a report called "Why Are Women Dying While Giving Birth in Nigeria?" This was a community-informed maternal death review, because when you know the reasons why something is happening, then you are more likely to put in solutions or interventions to address those reasons, right? And the findings from that review were very eye-opening, if you ask me. And if you're curious, you can always find the report, the full reports, from the Nigeria Health Watch website, nigeriahealthwatch.com. You go to the resources tab and you will be able to, it's on the top left of the screen of the page. Well, depending, if you're using phone, you have to maybe find menu and click on menu and get it. But yeah, you can get it from our resources tab. Just type "Why Are Women Dying in Nigeria" report and it will turn up.
Yeah, so now the good news is Nigeria isn't just sitting idle. We've had initiatives like the 2014 National Health Act and the 2017 National Reproductive Health Policy to tackle maternal mortality. Now, the MaMII project has been introduced, but what does MaMII really look like in action?
Exactly. What does it really mean? Like, yes, it's great to have the plan, but the next important thing is putting it into work, to make a difference in the lives of, women all over the country and by extension across the continent. And who better to break this down for us? Remember, that's why we are here, to break these things down, forget the big names, to help us understand how these issues affect us, why we should be concerned, why we should care. And who best to do that than Kachi, who she just participated in the MaMII implementation planning workshop. Like I said, implementation is very key. So she was there with other stakeholders across the country to figure out ways to, make this make sense for Nigerian women, essentially.
Yes. Hello, Kachi. Welcome to the podcast.
Hello.
It's so good to have you here virtually.
Hello, Asari.
Yeah, in spirit.
Hello, Chibuike. It's so good to be here. Thank you for having me.
Yeah, thanks so much, Kachi, for joining us. We've been hearing about the MaMII project launched by the federal government last year in November 2024. I'm saying this because we don't know when, maybe someone will be listening to this in the next 100 years. So they know when it was launched. But anyway, yeah, and essentially it aims to reduce maternal mortality in Nigeria. Please, we want to know, what is it? And can you tell us some of the objectives and goals of this strategy?
So in your intro, Chibuike and Asari, you have touched on, very critical summaries of what MaMII is. Maternal and neonatal mortality reduction innovation initiative. That's what MaMII stands for. And like you mentioned, it was launched November last year at the joint annual review. And it's aimed at the phrase crashing maternal mortality. Nigeria's maternal mortality rate is alarming, it's high. It's, to break it down, we would say 1 in every 200 women, 1 in every 200 live births in Nigeria will end up in a maternal death. So this is very heart-wrenching and requires urgent attention.
So from the meeting, are there any learnings or insights that you can share with us?
Okay, so just before I move to the learnings, you mentioned the goal to crash maternal mortality. Now, how is this going to be done? Which brings me to the objectives: to increase community utilization of health facilities. So if the community can begin to access the health facilities for their maternal and newborn health services, then we're on our way to crashing maternal mortality. And to also mention, MaMII is focusing on the high incident LGAs, high incident local government areas, which are 172.
That's 172.
Exactly. And these LGAs contribute up to 55% of the nation's maternal mortality rate. So MaMII aims to crash maternal mortality by increasing facility utilization in these communities, in these LGAs, increase facility delivery. So in these LGAs, common things that have been recognized, common behaviors include more home deliveries occurring in these LGAs as a result of low access or limited access to health facilities. So MaMII aims to increase delivery in these health facilities by skilled birth attendants. There's a whole component of training health workers, frontline health workers, to improve access, to increase delivery, and also finally to reduce maternal and neonatal mortality by 30%. So this is what MaMII is aimed at achieving on across these 33 states and 172 LGAs.
Thank you so much, Kachi.
Yeah. So are there learnings or insights you can share with us?
So for MaMII, the key insight is that initiatives this is not the first time there will be an initiative targeted at addressing maternal mortality in Nigeria. But I think the uniqueness of MaMII is that, firstly, it's being implemented under the sector-wide approach. The sector-wide approach is, the initiative designed by federal government also to create an alignment of health implementations in line with government priorities, one budget, one voice, one conversation around these implementations. So there's an alignment with all the key stakeholders and players in this initiative. Then there's a laser focus on interventions in the high incident LGAs. So other than just throwing this intervention across all the LGAs or across all the states, there's a focus on the high incident LGAs, which are the 172, like we have mentioned earlier, to take a deep dive into the key drivers of maternal mortality in this LGA. So this was done in Kano through field visits, social and verbal autopsy when it has to do with MPDSR. MPDSR is maternal and perinatal death surveillance response, which is a key quality improvement tool in maternal health care. So these drivers of maternal mortality were identified, and then targeted and tailored interventions were designed to begin to address them.
I mean, Kaji, you really said some really, important keywords, especially the first one. Crash is usually associated with something negative, but this is us now using it in a positive way. So we want to really crash it. So like drop it down, drastically. So we're really excited that is happening. And also what you said about targeted, and that makes a lot of sense, because rather than opening it up and spreading the intervention across the country, you target the people who are affected the most. And what's better way to be evidence-based. So that is data speaking. But I just want to know, what are the benefits, or what do we hope the target beneficiaries take away from this intervention?
On the surface, when you look at the plan, we see that there's going to be increased access. MaMII has strategic pillars around the framework that addresses both health facility programming, community programming. So there's going to be a boost in health literacy through the training of volunteers, training of frontline healthcare workers. There's going to be increased communications around why there should be facility birth, why women should access focused antenatal visits at the health facilities close to them. There's going to be increased access also by the time the health workers are trained, equipped in those health facilities to provide prompt health care, because the whole framework or the development of the MaMII initiative is around addressing the 3 delays that lead to maternal mortality. Delay around the woman making a decision.
I remember us talking about this when we were talking about when we recorded the podcast for MPDSR.
Yeah.
We were talking about the 3 delays.
Exactly.
Sorry, Kachi, I'm sorry to cut you off, but please, you can go ahead. What are the 3 delays?
So the delays around the woman even making a decision to access care at a health facility. So this will be addressed with her having ample information to make informed decisions about when to visit the health facilities. The delay around access, geographical access, financial access. MaMII is going to address all of this by providing increased enrollment, utilization of the basic healthcare provision funds, that's the state health insurance available for the community members. Then MaMII aims to address the 3rd delay, which is delay in receiving care when the client eventually makes up their mind to access the facility, overcomes the barriers that will impede them getting to the facility, get to the facility, and there's a delay in accessing care. MaMII will also address that by training healthcare workers, equipping them to provide prompt care. So there's going to be an increase in access to care for pregnant women, and there's also ultimately going to be a reduction in maternal mortality, because if these women have the right information to make an informed decision to get to the facility on time, attend antenatal, the cause and the history of the pregnancies are properly monitored, they receive the right counseling, the right care, the skilled birth attendants are present during delivery, then we are on the path to actually crash, in quotes, to actually bring down drastically this alarming and high mortality rates that we're experiencing in Nigeria.
Excellent.
Awesome.
Thank you so much, Kachi. I think that this has been such an insightful conversation, and I really like that MaMII is specifically focused on the 172 LGAs that have been identified, right, to crash maternal mortality rates. It's obvious that research has been done, and this is what is driving this intervention.
Absolutely. Asari, this has been really great conversation. I mean, something I want to clarify, Kachi, because I remember when this was launched, there's this concept or intervention that was thrown out also, or people mentioned a lot around that time about access to free CS, cesarean sections for women. So can you help us just briefly, as we wrap up the show, sort of understand how this ties into the MaMII initiative?
So there are a lot of interventions.
You mentioned
yes, because it is one of the components that is going to be deployed as an intervention in the whole MaMII package. MaMII comes with, I mentioned the health literacy. There's also the training of the health workers. There's also the use of data and digital technology, digital data solutions to complement the work that will be going on at the communities and at the facility. There will be provision of emergency transport services to aid, transportation, especially in emergency situations. And MaMII aims to improve referral from the primary healthcare facilities to the secondary healthcare facilities, where women can access free cesarean sessions based on the cause of their pregnancy or the history of the pregnancy. So this is one component amongst others that will be deployed as MaMII is being implemented across the states and LGAs.
Excellent, Kachi. Thank you so much. So I hope that everyone who's listening to this conversation has found it as informative as we have, because I know that we've been struggling to understand MaMII, struggling to understand how to even tackle the issue of why women are dying while giving birth in the country. So I think, as my own final words, right, I think that for the goals of this project to be realized, we all need to be part of executing this strategy.
Exactly. I mean, health is everybody's business, essentially, and maternal health care should be everybody's business, not a women's business or women's issue, right? So we want to hear your thoughts to what you think about this conversation, what you think about this episode. If you have questions, stories, or contribution about this initiative, right? How do we make sure that women are not dying while giving birth? Please, we want to hear these thoughts. If you have experiences you want to share with us, because all of these are what inform the policies or interventions aimed at addressing them. Please do share them with us by reaching out.
Yes, please reach out to us by emailing podcasts@nigeriahealthwatch.com, and don't forget to follow us on social media for updates. So we are Nigeria Health Watch across all social media platforms.
Yeah, thanks for joining us on this episode of the Break It Down podcast. Until next time, stay informed and take action to protect your health and your community. Chibuike here. Bye for now.
Bye.
Thank you so much, Kachi. Did we thank Kachi?
Kachi, thank you.
Kachi, thank you so much for coming and
Chibuike
sharing your
and
insight
Asari.
from participating in
Thank you, Chibuike and Asari.
All right.
Thank you, everyone, for listening.
Bye.
Thank you so much,
Bye.
Kachi.
Sleepy.